Hi guys, today's topic is healthcare a commodity, and obviously I will try to compare between the Canadian system and the U.S. system. The healthcare sector is by far one of the most complex industries to work under and to manage it well, with meeting patients' demands almost always one step behind. This is true according to Nobel Laureate Kenneth Arrow, who argued that healthcare is extremely complex as it is scientific based yet personal in nature and cannot be compared to any other marketable commodity. Therefore, it is even more difficult yet absolutely critical to develop a comprehensive standard that translates an organization's strategic objectives into accurate and reliable set of performance measures using KPIs or key performance indicators, which would provide meaningful results. We call it meaning for something. Sorry, I can't remember. That uncover inefficiencies and prompt the management team to make the necessary strategic improvements in order to stay competitive. For the healthcare sector, the difficulties in creating performance system is exaggerated by multiple stakeholder groups that overlaps in roles and expectations. And that is very true because doctors tend to obviously different areas or different specialization of doctors always think that they're the expert in everything. So when you're actually implementing like an EMR system like Epic, which is extremely difficult, and you have 200 people on the project from different departments, from different specializations, it can be crazy. It can be crazy. So for the healthcare sector, the difficulties in creating performance system is exactly by multiple stakeholder groups, like I said. As well, unlike for-profit corporation, public healthcare organizations are limited by the budget and bounded by stringent policies. With numerous distinct departments and multiple levels of referral networks and specialists, it is foremost important to senior management to set aspirational vision, mission, and purpose statements, and clearly communicate those statements to every single employee in the healthcare industry or institution. There is also a balanced scorecard that you guys can read it up. It's project management based. All right, I'll introduce it. For balanced scorecard, herefore referred as BS or bullshit, just like business school bullshit, MBA bullshit. To shine its most intended effect, an organization must first make sure that all stakeholders involved are aligned with the same strategic goals. And that is during the planning step when the stakeholder analysis is done for a project. The BS bullshit brings together the complex systems such as healthcare into four perspectives that drive management to generate most optimal solution by taking different trade-offs from the four perspectives into consideration to ultimately arrive at the best trade-off situation which aligns with organizational goals and yield the best future competitive direction for the organization. By taking the four perspectives that consist both internal and external to the organization and consider all of these operational measures together, management is able to view the organization as a whole and able to make better judgments when it comes to deciding what trade-off is the most optimal for the organization, as well as allowing the interdependent process wastes to be uncovered and eliminated like overheads or contingency funds. In addition, bullshit allows different organizations and business functions to prioritize the four perspectives of the balanced scorecard and even add additional ones when it is an important business function that needs to be measured and benchmarked against best practices. Bullshit fit into the business model of an nonprofit organization because it encompasses customers, innovation and learning, and internal business processes, all of which are usually what non-for-profit values the most. Wow, I wrote the very long article. Okay, last paragraph. There we go. However, NFP lacked the simple elegance of financial measure, such as profitability or shareholder returns, used by for-profit to assess the performance, as NFPs have goals to offer services at the best of their abilities. Intangibility. BS makes sure that overall strategic mission and goals were set before measurement perspective are created. So the resulting BS push. Oh my god, I can't stop laughing at that. Will be aligned with the corporate goals. By adding the quantifiable measures to each of the BS perspectives, non-for-profit is able to incorporate the financials into the decision or programs they are implementing, and would prioritize the service they offer more effectively. NFPs will not only improve their internal business processes, but will also be able to offer the right program to the right patient group while having the budget under control, which has always been a headache for non-FPs. Overall, sorry. All right. Overall, BS is a flexible tool that can be customized depending on the organization's needs and pushes management to consider the different trade-offs and really consider it by doing different strategic analysis, financial analysis, and the business plan. Ultimately, implement the decision that will yield the max value for the organization and its patients. Thank you.